focus on breaking down risk management problems bit by bit until we find a solution. If you would like to discuss anything you hear on GPP with us, please reach out using the links in the description. Enjoy today's episode.
What's up, man? Thanks for coming in.
Hey, Elliot. Hey, Ryan. Thanks for having me in.
Yeah, man.
Good seeing you.
It's going to be fun. We have already had some fun on the show before the show.
You missed the pre-show.
Yeah, we always talk about the show before the show because it's always great.
That's how we get new guests. We lure them in with the show before the show.
Yeah, because nobody ever actually sees the show before the show.
That's behind the paywall. You got to behind the paywall.
That doesn't exist yet.
It's right there, trust me.
Building all this content for the paywall, yeah. I'm excited about this because you have been around and in the risk management industry in various different ways.
Sure.
Not only what you're doing today, but you used to be in the financial services arena. So maybe just give us kind of your background as well as what you're doing today with Strada and kind of how that fits into the health insurance space, and we'll go from there.
Yeah. So I am originally from Omaha. I went to school at a small school in Michigan called Hillsdale College for financial management. And when I graduated, I knew I wanted to work somehow with people. I come from a family, or my father is a physician, and I loved how he was able to solve problems with people and form like really good relationships with them based around like an integral part of their life. And I think to some extent, your health and your money are some of the two most personal things about you that someone can help you with. And so I worked kind of like I interned as an analyst, and I thought I was going to go down that route, and I ended up working as an advisor out of school. And it was fun. I was telling Alex before the podcast today that my dad and I used to do these health and wealth seminars. He would talk about something related to health, and I would talk about something related to money, and we would bring people in and we would have a really good time. And I worked for some really great companies here in town. And right when I graduated school, my father started his concierge practice. And for those of you who are not familiar with concierge medicine, it's a lot like a country club, where you pay a fee to get in. Only so many people can get in. And it's designed to be somewhat exclusive. And it's not exclusive just to be like uppity about it. But my father's idea behind concierge medicine was to say, a doctor can only care for so many people in a given year. And we can't keep telling doctors, here's your patient panel of 5,000 people and you need to see 40 patients a day. It's not sustainable. And so around the time I graduated, he launched into concierge medicine, which is the idea that I'm going to have a smaller patient panel. They're going to pay to have access to this smaller panel. And we're going to see what happens. And in a town like Omaha, it just took off. People were very supportive of it. And he grew that really well. And as I was kind of growing in my investment realm, one night we were having a glass of wine and talking about just healthcare and how broken it was and how, he's taking care of pretty successful business owner type people in Omaha. Yet Joe the plumber is still getting crappy healthcare. And how can we figure out a way for everyday Americans to get better care? And he's like, the most important thing I do with my patients, it's not my degree, it's not my background, it's not I'm smarter than the next doctor. I have more time with them. I can just listen to them. And my patients can come to me anytime they need to, and I'm never prohibited by what an insurance company says I can do, or by the clock that says I have another patient in the waiting room and I need to move on to them. And so we got to thinking, and we're like, if we could give docs more just in everyday, or give docs more time with patients in everyday care, we should be able to improve outcomes. How do we do that? And so as we started doing research, we're like, doctors today spend over 50% of their day pecking at computers and doing administrative work. What if we eliminated 50% of that time and transition it into doctoring? So why are we having doctors with MDs doing all this administrative work? So anyway, we then launched kind of a brainchild of our family was to launch Strada. And Strada is a direct primary care company. The idea behind it is that you pay your physician a monthly fee, and under that monthly fee, all your care is covered. You go as often as you want. You never have to worry about using an insurance or a copay or any other office charges that would exist inside of that. And we started it thinking that, we're going to see how this goes. We're going to launch it in an exam room inside of our concierge practice. And we had, over the course of the next year, we had a number of businesses approach us saying this would be an awesome benefit for us to offer our our employees. And we can talk about some of the details of how that works and why that works. But today we have clinics in 12 states serving employers across 12 states. And our mission today is a little different than when we started. When we started, we thought this is a really interesting new approach to care for patients. And today we look at the healthcare market as really broken, kind of like we did. But Strada's mission is to solve it from the employer level right now. We want to go to companies, which on average pay for the majority of the healthcare expenditures outside of Medicare come from employers paying for their employees. And so we're like, if we're going to solve healthcare, we need to go to the employers and bringing them our approach, which is direct primary care, and talking to them about how it makes way more sense to pay a doctor directly than it does to ask an insurance company to pay them in between. So as we grew Strada and our business thankfully was successful, I jumped out of investment advising and started to do this. And there's some funny parallels that I've seen that I've learned that I've been doing in both. But I'm really grateful to be in Omaha. I love Omaha. I love working out of here. I'm grateful to work with family. I know that you're in a family business, and it's not always easy, but I think it's really rewarding to work with family. And I love it specifically. I love working with my dad. I think my dad's a brilliant physician, and I love being able to take his concepts and ideas in ways to better healthcare and be able to run with them. So I know that one thing that we talk about a lot in our world is solving it from the employer level. I know that for Ellerbrock Norris, you guys talk about this as well. I'm curious, what brought your company into the health realm? Because that's somewhat of a, it's not, you guys haven't been doing it forever. So what caused Ellerbrock Norris to pivot into the healthcare realm? Because I know that our missions kind of align in that area.
Yeah, I mean, it was simply opportunity. It was a natural segue from the risk management P&C space, into the health insurance side and healthcare overall. But there's a ton of opportunity, and particularly, I think, and this is where I'd like your perspective too, but for an advisory approach, there's a ton of opportunity in the healthcare space.
Right.
Because many brokers, similar to P&C, are still approaching it from that product mentality. There's a shift certainly happening with a lot of firms that are shifting more towards quote-unquote advisory services, but I think a lot of that is disguised as, or shiny object syndrome is disguised as an advisory approach. Like, we have the next thing, like HealthJoy or whatever.
Sure.
And that gets sold versus what problem does that solve for you? And sure, this tool might be a fix, right?
Right.
And so I would that's I guess my approach and how we kind of transitioned or I guess started a new division in the healthcare space. We were doing health insurance, but it's kind of like we got to jump all in if we're going to do this, right?
Yeah.
And but that's, I mean, what's your perspective on that? I mean, you work now, I know, a lot with brokers to try to, how does this fit into a plan, and just what's been your perspective on working with maybe the more transactional brokers versus the more advisory brokers?
Yeah, well, what we found is if a broker's job is to go out there and find you a solution for your healthcare for your company, and they get paid more based on certain solutions that they bring to the table, I think you should be really suspect at the solutions that they're bringing, and at least, be skeptical. Because it's very different from an advisory approach where you pay me a fee to bring you the best solutions. And if I don't bring you the best solutions, you're going to fire me and hire somebody else. And I don't get paid more if I bring you this service or that service. So my job year after year is to wow you and make sure that all the vendors that we're bringing to the table are the best of the best. And we've found over time that it still isn't a transitionary phase. We were saying in the podcast before the podcast that health insurance brokers today, I feel like, are kind of like stockbrokers in the late 90s, where they're still in this transition where, today you don't call a stockbroker to buy a share of Apple that takes a commission. You would do it. And most advisors today charge a management fee, and they don't get paid more for different services that they sell you. And we're still in a transition phase, I think, for health insurance advisors to get to that level. But I would certainly encourage employers out there that really, really look into how your benefits advisor is being paid, and you should know how they're being paid. And I think the advisory route, similar to how people manage money, makes the most sense. I think the other thing that I've learned over time is that we've been conditioned as Americans to believe that healthcare is expensive, it's confusing, and that if it only goes up by 7% year over year, that's a really good renewal.
Don't have control.
Yeah, we don't have any control over it. And I think we need to drop that and approach it from a different standpoint, especially when, like, for many employers, it's the second biggest line item on your budget after payroll is your healthcare. Yet we give it to, God bless HR people, and they're so busy, but we give it to them as one more thing that they need to manage. When in reality, I think the healthcare spend for employers deserves its own strategic plan where we look at how do we start unbundling these costs and truly understanding where we're spending money. Because if you don't understand where it's going, you're not going to be able to solve anything. And it is amazing to me, though, kind of back to what I said earlier, how we've become so apathetic to the healthcare spending of it's expensive and I know and it sucks and we're not going to be able to give out raises this year because healthcare is expensive, rather than going to the root and saying, why is it expensive and how do we solve that? And I think that there are solutions out there. It just takes uncomfortable conversations.
It takes work.
It takes a lot of work. Yeah. And a lot of times it's easier just to go to everyone and say, hey, everyone, insurance is going up this year, And it's not as hard because they look around and
we got to share the cost.
It's going around everywhere, so why wouldn't it be going around for us? When in reality, I think if you really, really work hard, you can find a solution that would work best for you and your company that would save you a lot of money. It requires you to completely forget everything you've been told about health insurance and approach it from a new standpoint.
How many of those conversations start right there, but then they call up their broker and get shut down?
Yeah, I think probably a lot. Because
it's like they're asking the guy that's making more money year after year by their premiums increasing. Like
right,
how
yeah.
they're going to decrease their costs.
Right. If you get paid more if your premium goes up, why would you want to lower the premium? And that's not to say that health insurance brokers are out there trying to screw people, but it is an adverse incentive.
It's just the way it's been set up.
It is an adverse incentive.
Well, and you can make a ton of money by building a book and not working all that hard, frankly. It's a lot more work to have to constantly be looking for value and what you're bringing to your clients through an advisory relationship.
Yep.
It just is.
Yep.
And again, it's nothing against those that are operating that broker model because you can make a ton of money. You can, do a lot of the right stuff, but it is figuring out how do you, whatever way you're compensated doesn't necessarily matter. It could be a misaligned incentive, but a lot of people are doing the right things on the just broker side.
Right.
But
yeah.
That's why, people have been able to live a long, happy life in the insurance space based on getting paid commission.
I'll tell you what, yeah, we like to say a lot that having health insurance doesn't mean you have health care.
Yeah.
There's a lot of functionally uninsured, we like to call them people that you've probably read, Ryan, you know better than anyone, that how many Americans live with less than $1,000 in their savings account. It's frighteningly high how many people that is. And so we go to those people that have less than $1,000 in their savings account and roll out a $5,000 deductible health insurance plan and say, here you go, here's your benefit.
Yeah. But here's an HSA.
With a $15K max out of pocket.
Yeah, they can't afford to use it. And so what happens is we go approach these places, they're like, oh yeah, we have a health insurance benefit already. But how good is a benefit if people are scared to death to use it because they don't know, they have no clue what it's going to cost, and they can't really even afford to use it. And so our approach is like take people that, rather than just giving them health insurance, purchase them care. Because you can actually purchase someone 24/7 physician at their disposal for not that much money a year, and we call it direct primary care. So we tell businesses all the time, like, look, insurance is important. You need to have insurance. But you can't only roll out insurance for people and expect that they're going to go use it, because a lot of people are scared to death to use a high deductible plan.
Or use it the wrong way.
Or use it the wrong way.
Well, and the other thing that's funny to me on the health insurance side, when you think about like the P&C side, it's designed to be for catastrophic claims, right? You don't turn your oil change into your insurance carrier, right? Maybe you and I have had this conversation.
Yeah, it's true.
Don't do that,
it's a great parallel.
You do it for when you total your car or you've got an injury or whatever, from an auto accident.
Yep.
Health insurance is the opposite. It's like if I'm going in just to get my annual physical, I got to run it through my insurance company.
Yeah.
And it shouldn't be that way.
Right.
It should be, yes, we need insurance, but we need insurance for when I get cancer, or for when I have a heart attack or break a bone or whatever.
Yep.
And then how do we handle the day-to-day stuff? But I also think what's interesting, and the statistics are bearing it out, is those people that get care earlier don't have as many big, large claims, right? Because they're getting access to the appropriate care, versus somebody that has a high deductible is less likely to go get the MRI that they need, or the colonoscopy, or whatever. that might prevent, finding cancer at stage 1 versus stage 4. And I think that's a very important piece of something like DPC, or really, any of those types of services that remove barriers for the insured, right?
Yeah, we definitely view insurance probably the same way you guys do, which is you should purchase insurance for things that might happen, but you hope they don't. So we insure those things. But like you mentioned, I know I need an oil change every year in my car because I don't drive a Tesla. And so I just pay for it myself. I don't buy insurance for that. But like most Americans need to go see a doctor every year. Yeah. Or they should.
They should,
right?
Yeah.
And especially like if you're chronically ill, you know that you need to go do these certain things. Why would we use insurance to pay for something that we know is going to happen? And so and I can take it back to the business again. If I'm a larger business and I know there are these certain like healthcare expenditures that my employees are going to have to get, why would I let an insurance company dictate what I'm going to pay for that? I think that it makes way more sense to start going out and negotiating directly with physicians and providers and specialists and saying, we're going to start paying you directly. And it's amazing how much physicians are excited to take money directly.
Yeah. They hate working
rather
with
than
There's a ton of costs wrapped up in it going to get.
Yeah.
It's back to what I said earlier. 50% of their day is spent doing administrative work to get paid by insurance companies. And so we think that that's the way healthcare is trending into the future, whether you believe in single payer or not, and I don't know if any of that's going to go through. But we believe that Americans 20 years from now will purchase their day-to-day healthcare, or it will be purchased for them by an employer, however that works, directly. And day-to-day stuff like generic medications, imaging, even some specialist level visits are all going to be just compensated directly. There's no need to have a middleman in any of that. Back to what we talked about a little before, which is when you allow a physician to spend as much time as they need to with a patient because they don't have this massive panel, it's amazing how much a primary care physician can handle that they otherwise just wouldn't be able to.
Yeah.
Because they take that consultative approach versus in today's insurance setting, they have to see so many people because it's transactional. And I think that just as you all see a benefit of taking a consultative approach and an advisory approach of like, I'm here to help you, and there's no like transaction and nickel and diming along the way, we need to get there in healthcare so people, to allow primary care physicians to do what they do best, which is care for people. And right now, they, for the most part, in many systems, they just are cogs in the system that see people and have to meet certain referral patterns to, get their bonus.
Yeah.
I'd like to hear your guys' thoughts on this. So when you were, it's kind of interesting because no human wants to take care of their own healthcare. Maybe there are a few people out there that want to do that, but most people go see somebody.
Sure.
Right? Because you got to ultimately be able to look at your blood panel, or maybe have a picture taken of inside your body, and that's really hard to do at home.
Yeah.
You have an at-home MRI or something we don't know about?
No, I don't. But in the risk management space, I feel like, going back to you don't buy insurance to change the oil in your car, but all of the risk management in the risk management space falls back on the company. They're not
the
employer.
Yeah.
They're not going out and getting help from risk advisory services anywhere else. They're purchasing the insurance for catastrophic events.
Right.
And then the advice stops.
Right.
It's very true.
Humans at least oh shit, my stomach hurts. Let me go to the doctor. And they go seek advice. When in the P&C space, they rally internally to figure out everything else from a risk standpoint. And they just go out for the product. Mm-hmm. And I don't know, maybe it's another reason why we're facing hurdles and shifting to the advisory space.
Well, this is a weird,
because there hasn't been this mechanism to force them out to go get help.
Right. I have this weird theory that as companies take a more direct approach to purchasing healthcare, you go to these business owners, I don't know anything about healthcare. How am I going to go negotiate MRI? I don't even know what an MRI is. Yeah. How am I going to negotiate it? A weird theory I have coming out of COVID is that we're going to see more chief medical officers inside companies than we've seen in the past moving forward, especially fractional chief medical officers that will exist to help companies navigate medical type stuff. Because if the only person you trust with like medical knowledge to navigate medical things is an insurance broker,
Right.
that's a problem.
Yeah, that's a
And we
problem.
realized this coming out of COVID. So like when COVID hit, a lot of people called their insurance broker, and they were probably just as clueless as the rest of us about like, I don't know how to manage this or what to do, and they're trying to figure it out as the rest of us were. But the people that actually knew what they were talking about were the physicians. Like I remember early on in COVID, and my father's talking about antibodies and IgG antibodies and IgM antibodies, and it was not like he had like done all this research. He just knew it because he's a physician, and he knows like if this is a coronavirus, these are the type of antibodies it's going to exhibit, so we should test for stuff like this. And it became very apparent that like companies needed advice like that, and so we actually served, and some of our physicians served as like quasi chief medical officers for some of these companies to help them navigate. And I think as companies begin to purchase healthcare directly, they're going to have someone on their leadership team that understands that stuff to some extent. And I thought of that as you were talking about kind of what you said earlier of how are companies going to navigate this moving forward, because otherwise all the risk just comes eventually right back on them. And so they need to have some understanding and some like guidance as they move through, this
that's super
environment.
Super intriguing.
Well, it's a different way to like pitch, or if you have somebody in the risk management space that's operating truly holistically to have that same approach.
Right.
To, you're going to have a chief risk officer, outsourcer, a fractional chief risk officer that's going to come in and help you manage all of these pieces.
Right.
That's completely different than a broker placing a catastrophic product.
Exactly.
Yeah. So let's take the flip side of this. How much opportunity does the broker have in this industry, in this space, to think about things differently and maybe come up with the idea of, hey, let's figure out a way for you to get medical advice in your organization as in their client's organization. How much opportunity is out there to have that mentality going to their brokers versus the flip side of like, oh, it's doom and gloom for the broker, whatever.
Right.
Like, brokers are going to live a long, happy life. Like eventually it's going to turn.
Right.
But it's going to take a while. So you see what I'm saying? How much advantage or opportunity is out there for those that want to take this approach?
Yeah, I think there's tons of opportunity, especially if your approach is I'm looking for solutions to like
trends that we're seeing that, this type of...
Yeah, I mean, if you're looking at things like direct primary care, I think you have all kinds of opportunity because a lot of employers have never heard of something like direct primary care before. If you're approaching it from the standpoint of I'm your advisor and not your broker, I think that you're different than a lot of the competition. And frankly, from a lot of the conversations I have with business owners on the direct primary care side, like they're so hungry for innovation because they're sick of coming back to their employees year after year and saying, yep, it's another increase. Yep, it's another increase. And it's the same old benefit, just a little bit more expensive this year. Or it's the same old benefit and it's the same price this year, but really being able to help guide them towards here's what the future could look like. And I know we've all heard stories of like amazing health plans that have put together these awesome benefits. And it doesn't have to like, I don't think you're going to get anywhere approaching someone and saying we're going to completely revamp everything next year because that's an HR nightmare.
Yeah.
But I think showing someone that like the future doesn't have to look like this and you can take control of your health spend. And now you can't do it in every scenario.
Oh, totally.
And there's certain cases where being insured with, fully insured, like it's just the right approach.
Sense, yeah.
But I think carrier shopping year after year between 3 or 4 carriers in the Nebraska market.
Not the answer.
It's just not the answer. I think we really have to start thinking outside the box. I heard, or I was reading just stats on, I think telemedicine is definitely here to stay. Everyone got to experience it during COVID. I think the opportunities to get as much care over the phone is going to be intriguing to a lot of millennials. And so you'll start to see the medical space, I think, pivot towards that here soon. But the opportunity for advisors out there to mitigate risk, not using insurance, and instead just using doctors to mitigate the health risk of a population, I think is huge. And the direct primary care movement is semi-new. I mean, it's only been around for 10 years-ish, which is not kind of a blip on the spectrum. But it's not going away. I mean, it is, we haven't even talked about this yet, but the economics of direct primary care makes sense for doctors too. Doctors.
Yeah, that blew me away when you first walked in.
Yeah, doctors want to make more money, just like we all want to make more money. But on top of that, they also want to take really good care of patients. And, the best way to take care of good patients, like my father said a long time ago, is spend more time with them. If you have a relationship and you spend time with them, you can take really good care of a patient. And the way that they do that is direct primary care. But if you only have, 1,000 patients, let's say, and you charge them $70 to $90 to $100 a month per patient, it requires very little overhead, very little administration to do that. And if you do the math on that, you actually, as a physician, can make quite a good living as a direct primary care doc. And the question that we get a lot is like, well, if average doctors will, see 5,000 patients right now, and you're cutting it down to 1,000, where's everyone going to go?
Oh.
Right? Aren't you going to run out of physicians? And our worry is we're already running out of physicians primary care physicians, because no one wants to go into primary care today.
Yeah.
It's such a miserable world to be in an insurance, because you spend more time doing insurance work than you do seeing patients. But when you talk to a resident student about direct primary care, they get excited, because now it's like, I get to practice medicine all day, and have relationships with people. And so we think direct primary care is the way to get more physicians into primary care. And we need that as a space. Otherwise, we're going to get all our primary care from Walgreens, Walmart, and CVS someday.
Yeah. And the economics work for the doctor, right?
They do. The doctor makes more money.
Yeah. That's what blew me away.
And generally, the patient is paying less money. And if the employer's saving money, the people missing out is just the big, tall insurance buildings, that have all these administrative staff adjudicating primary care claims.
Yeah.
And nice stock returns.
Yeah.
Well, it hasn't been much since the Affordable Care Act got passed. It's only like, 484% or something like that?
Actually, a little
It's not bad, yeah. It's a little higher now? Okay.
Round up to 1,000.
Yeah. Okay, so I'm curious your guys' perspective on this for both of you, because you have a background in the financial services space. That's what you do. This shift happened in that industry side of the industry. We've talked about this on the show before, but it was kind of forced, right, in a lot of regards from a legal perspective.
From the broker to the advisor.
Correct. Yeah.
Right.
But there's still obviously brokers that do very well today and whatnot. But so to say that this shift is going to happen quickly or overnight is not necessarily the case. However, what's your perspective on when that shift happened, how long it kind of, took, and then those that did make the shift, what was their experience, with the clients?
In the money management world,
yeah.
Or in the, I don't know if I have really good insight on that outside of some of the older people that I had worked for that had been through that transition, and I know that a couple of them in particular, they were kind of like lone wolves out there doing this on their own. And the scary part is, and it's probably the same in the health insurance realm, is when you're paid a commission and what you make is a little bit in the gray area, I don't know, it avoids that awkward conversation of what am I being compensated. But when you have to go and say, this is what you're going to pay me for my advice, it's a different conversation.
Oh, yeah.
And so I think that's probably why that transition took a little while, is because it's a lot easier just to get paid a trailing commission on an old product I sold 20 years ago than to have to year over year bring value to my clients for them to want to continue to pay me. And I think it's made the investment world a lot better. I think it's cleaned up a lot of shady players. And I think that for people that are in the health insurance realm, I'm guessing that there's some anxiety about going to an existing client and saying, this is what I'm making commission, and I'm not going to do that anymore, and I'm going to go, fee-based or whatever the word is, consultative. And, it all nets out of it, whether they're paying commission to the insurance company. Yeah. It all nets out, but it is a different feel. And I don't know if you've ever had to do that, or you've ever had to do that with a client that you transition from commission to direct, but I think it makes us all better, and it puts everyone on the same side of the table, in my opinion.
And brokers are supposed to, health insurance brokers or advisors are supposed to, by law, going to have to do that here. At the end of the year was passed I'm going to forget the name of the law, or it was put in force, I should say.
To disclose your commissions?
Yes.
Okay.
Oh,
sure.
All compensation.
All compensation.
Yeah.
Okay.
Because there's not just commissions on the health insurance side.
Sure.
And so I do think hopefully that helps with some of that shift, because at least even if you're collecting a commission, you have to disclose what that commission is, and any rebates, any contingencies, overrides, whatever it is.
Right.
I don't know if you had any additional kind of thoughts on that. I just feel like that shift is starting and is
Well, I think
getting ready in the health insurance space.
as you kind of alluded to, I mean, the catalyst for a lot of the change in the financial services world was centered around the stock market crashes.
Yeah.
And, it took people felt it in their pocketbook, and you couldn't just call a broker and get the advice that you needed and making a stock trade and taking a massive commission.
Right.
You needed advice well beyond that.
Right.
So I think about, we talk about different things that could happen in the risk management space that could, happen and negatively affect a ton of people that would force some sort of change. When I think about the healthcare space, I think about COVID, I'm like, man, was there any opportunity looking back at COVID to have it disrupt our current healthcare model and move us closer to more objective, holistic, care than our current model?
Well, I would say, if anything, I'm sure a lot of people in the last year got to see the doctor to some extent, whether they had COVID or they felt like they had COVID. And when you talk about risk mitigation, one of the best things you can do to mitigate risk on the health side is to go see your doctor at least once a year and make sure that, as my father likes to say, it's not a sick appointment, it's a healthy appointment. It's how healthy am I this year? And what goals can I have to improve my health over the next year? And I think more people need to do that, because when you look at a population and you say, okay, how can we mitigate risk, or how can we help you manage the risk of this population from a health standpoint? I would say one of the best things to do is get people to go see their doc. And I think, unfortunately, the easy button that a lot of times companies will press is like, we're going to have this new wellness strategy, right? Where everyone's going to get points or like a gas gift card.
$5 to go to the gym.
To go do these certain things. And I think that there's a difference between a nurse coordinator calling you on the phone to remind you to take your hypertension medications, and your primary care doc sitting you down and saying, dude, you're unhealthy. You need to get better, and you're better than this. And we've seen it. We think that primary care doctors should be the ones that are managing that day-to-day risk in a person's life, and not the care coordinators out there that are kind of managing it for them right now. And the reason that those companies or those services exist, because doctors don't have time to do it right now.
Yeah.
So anyway, I think that when you talk about how the risk mitigation in health, it kind of all falls back on primary care a lot, because primary care and preventative type healthcare is the way that you keep from having all these high claims that just blow up a health plan in a given year.
Yeah, and that's the interesting thing to me. It's like, it's an oxymoron to business owners when you first talk about that, because they're like, well, why would I want to send my employees to the doctor more? Like, that's going to be so expensive.
Right.
And it's like, it's the reverse, or the deductible conversation, because they've been so beat down that, well, it's going to be a 12% increase this year unless you raise the deductible by $1,000, so that you're sharing in the risk there, Mr. Business Owner.
Right.
And if you do that, it'll only be a 7% increase. And it's
Right.
like, that deductible increase means zero to the insurance company. Like, it does not matter, because most of the claims are generated by like 5% of the population.
Right.
And so it has no impact. It's just a shell game, right? They just want to turn your attention to the deductible. But in reality, you want those deductibles as low as possible if you want your people to get access to healthcare. Or the flip side of that is just get something like direct primary care, where you're just paying for that care for that employee, so that they are getting access to that physician on a regular basis. And then when things that might be a bigger issue come up, they're texting essentially their doctor and saying, hey, my shoulder hurts.
Yep.
Like, what do I do? Otherwise, they're going to let it sit for 6 months, and now they got to get shoulder surgery. When it could have just been PT or something.
Right. Yeah, Ryan would appreciate this, but we like to say primary care is an investment. Everything else is an expense after that. And so if we approach a business and they're like, well, no one goes to their doctor here, and so why would we spend money on primary care? And it's like, well, I don't know. Like, if you're not investing in your health plan, it's not going to look very good in the near future. And so we look at the primary care component of a health insurance overall spend, or a healthcare overall spend, different than the rest, because the rest kind of there's only so much you can do when it comes to some of these high claim or just sicknesses that people will develop. But if you're not doing anything to invest in the primary care, then how do you expect to get good results on the back end?
I read something the other day on LinkedIn, and it said, when you have your health everyone wants everything else. And when you don't have your health, you only want one thing.
Yep. So true.
That's a good point.
And it's like, okay, got it.
Right.
Yeah.
Right, and it's probably similar to investing, where they always say, like, the earlier you start, right?
Yeah.
And the better off you'll be.
You get some compounding health interest going on in there.
Yeah, it's like, you've heard the whole, like, penny doubling a day for a month, and it turns into, like, I don't know, $5 million or something like that. And it's funny because it's like, it's the old riddle of I'll give you $1 million today or a penny and I'll double it every day for 30 days. Which one do you want? Most people would take the million, when in reality the penny's the better one. But it sucks because the first 7 days you're doing that, you're like, what the heck am I doing? It's like, I got 2 pennies, I got 4 pennies, and I got 8 pennies. I'm a schmuck. Like, I'm 2 weeks into this, I got like $10.
Yeah.
But all the benefits are on the back end, right? It's on like day 28, 29, 30 on that thing that it really pays off. And I think that there's like some parallels there to healthcare that, like, if you put in the daily work or the annual work even of just going and getting your blood drawn with your primary care physician, there's so many compound benefits to that you just don't understand sometimes unless you're doing them on a regular basis. And we shouldn't be in a situation where anyone has any barriers between themselves and their primary care physician. And I think it's good that, like, for example, the ACA says that your annual exam with your primary care physician is covered under an ACA plan. I think that's good. But most people go and it's a 5-minute visit. And they're like, your
experience is terrible.
Well, but like your cholesterol's high. We want you to come back in a month and we're going to do that again. Or we want you to come back next quarter and we're going to do this again. And we'll recheck your levels. But that visit's not covered. The blood work's not covered in that visit, right? And then do you think they go? Most people just don't because they're scared of the cost.
What's the advice between that visit, the first visit and the second visit?
Oh, and there's just so much lack of trust right now in the medical community. Like, I saw on an example, I think it was on a LinkedIn deal too, that was like somebody went in to have a covered procedure, got it all pre-auth or whatever, and they, like, a scope in their knee or something. They got in and they saw something else, so they had to take a diagnostic exam or whatever. And the diagnostic exam that led to this and that was like $7,000, not covered.
Yeah.
They pre-auth, and it's like, well, hang on, I'm asleep on the table and you're doing whatever you're doing to me and it's going to cost me $7,000 and I got no say in it. And it's like, it's probably the right thing.
Sure.
But I had no opportunity to, shop that or to make a decision whether or not I wanted to do that or whatever. And all of a sudden now I'm out $7,000.
Right.
And it's just like, there's just so much mistrust in a lot of that stuff that stuff happens and that stuff goes on. I think that just having somebody that's an advocate for you in the healthcare arena is so important,
It's kind of like having a doctor in the family, we say.
Yeah.
If you don't have a doctor in the family, you wouldn't know what that's like. I just know what it's like. But it is. It's if you have someone in your corner that you can call and bounce ideas off of, and make sure that you're not crazy, and don't trust Dr. Google with every possible medical thing that comes up. It's amazing how much can just be mitigated by just that alone.
Yeah.
And you've probably seen that on the health plan side where they have second opinion type services that you can buy for surgeries and things like that. And we think that there's all kinds of second opinions you need day in and day out for healthcare. And most of the stuff is just really tiny. Do I need stitches or do I not need stitches? Should I take this antibiotic for 3 weeks or 2 weeks, or what should I be doing? Because I forgot what you told me in the exam room. Those types of things are just so, like, those little things that pay off in the long term that we think the ability for us to delete any barriers or red tape that exists between those little conversations between primary care doctors and patients, we should get rid of all those barriers so that they can happen naturally.
I think that's just half the battle. I mean, it is just a crappy experience to walk in to go see a primary care physician.
Yeah.
Like, I think you were at an office visit last week, and we were talking about them constantly running behind. It's the only profession in the world where it's completely acceptable to sit in a waiting room for 30, 45 minutes after your scheduled appointment and still be happy to walk in that room.
Yeah. And then get your 5 minutes and then you're back out.
Yeah, because they're running behind. And it's like, there's got to be a better way.
Right.
So to be able to fire up your cell phone and shoot a text.
Most people that are sitting in the waiting room don't need to be there for an in-person visit. It's just historically, especially pre-COVID, the only way that a doctor could bill was if
they saw you.
Your
Yeah.
Butt was in the seat. My dad likes to call it something else, but butt in seat medicine we'll call it. Yeah. And that's what it was. It was all these people here in the waiting room are here for prescription refills, and they're here for second opinions on something. And in reality, it's like we can handle all of this. But the reason that they're there and they're not using their works telehealth thing that they pay for is because they trust that doctor in that exam room. Even if they only get that doctor for 5 minutes, they trust that person. Yeah. And we know, again, like back to our principle, relationship with a primary care physician is one of the most powerful things in healthcare. Yeah. And so that's where like our approach to telemedicine is different, because the person on the other end of the phone is your primary care physician, and it's not just some random doctor. I think COVID helped that a little bit when you talk about how did COVID disrupt things. It forced regular old doctors' offices that didn't have telehealth to all of a sudden find a telehealth solution. Yeah. And it also kind of like changed insurance billing laws and allowed them to bill for it, and I think probably will forever.
There you go.
And so what we're finding, I actually ran into this a little while back, where they're saying that the larger players in the telehealth industry may have a tough time like meeting the same growth trajectory that they were before. Because people are like, why would I use Teladoc when my primary care local doc has this like app that I can use to call them? And like, yes, it gets billed through my insurance and all that, but I'd rather talk to him or her than I would to some random person. And so COVID forced every day.
Which is a lottery, let's be honest, on a little.
It is, yeah.
And you got to wait for 2 hours.
Yeah, exactly.
On hold.
It only cost me $10. Hang up and book another appointment. See if I can hit the lotto again.
That's so true. Awesome, dude. Well, anything that we didn't cover that you kind of wanted to hit on, go over that's on your mind?
Holy shit, you're going to give him that?
I got a list about 10.
Opening it up. Because you never know where it's going to go with Bessmer.
I think we covered a lot. I appreciate the opportunity to just talk about what we do. I think, to your point earlier, there's tons of opportunity to disrupt healthcare. And I think disruption is a really good thing when I say that. I think this is an industry that absolutely needs to be cracked open and looked at from 10 different angles. Yeah. And that, we're kind of all preaching the same language to employers, that if you're just the same status quo year after year, you really, really need to take a tough look at your health expenditures, because they don't have to be as high as they are, likely.
Yeah. Well, and I think the beauty of what you guys are doing too is it shows that, I don't think any of us believe government intervention in healthcare is probably the best approach at this point. But it does show that, entrepreneurs, what America's based on, is what can solve this, right? I mean, you're seeing it in a lot of aspects of healthcare, direct primary care being one, but on the prescription side, you're seeing a ton of it, where people are saying, look, there's a better way. We think we can solve this. And where we can solve a problem, there's dollars, there's value.
Yep.
And I think you're going to see more of that, which is what we all want. And what if we approach it from an advisory perspective, we're going to be able to bring a ton of value to our clients. Even if you just come in and say, hey, have you ever heard of direct primary care? I heard this guy talk about it on a podcast. I think it might be kind of cool. You're going to bring value to a couple clients,
Sure.
Somebody's going to go, no, but I'll Google it, And so,
right.
All right, dude. Well, thanks for coming in.
Yeah, dude. Good. Keep doing what you're doing. It's awesome.
I appreciate the opportunity, guys. Thanks for having me on.
Yep. See ya.
Bye.
Thank you for tuning in to Getting Past the Premium. We are excited to continue breaking down barriers and finding solutions together. If you would like to reach out regarding anything you heard in today's episode, find links and contact info in the description. Until next time, have a great day, and let's continue getting past the premium.